is Nadia Hikaribal. It's a great pleasure to welcome Nadia, who is lead for the Menopause Service at Kumtaf University Health Board from last year, and she's very interested in women's health and education, and is going to talk about menopause ethnicity matters. Nadia.
Thank you. Firstly, I'd like to thank Mina, Sue and the organisation for giving me the opportunity to present this afternoon. These are my disclosures. I do a lot in my life, but what I would like to say is that I do not see myself as an expert on menopause and ethnicity. I'm a shop floor clinician. I've worked in women's health for as long as I can remember, and this is obviously a topic that's very close to my heart. However, I suppose me standing here today starts with actually being seen. And in 2021, I was one of the MWA winners for Health, Science and Technology, and I'm very, very grateful for that appointment because it kind of put me into a spotlight, which I probably shied away from all my life. And then in September 22, with the first conference, Mina and Sue asked me if I could talk about menopause and ethnicity, and it's an area that I'd started to get interested in, and so I thought, okay, I need to make a conscientious effort now to look at this in more detail. Okay, so my talk in 2022 was ethnicity and looking at menopause and does it actually matter? And then in April of 23, I was asked to do a presentation at the Wales Menopause Network, and again, it was an area that I was looking into. However, in June of 23, I was appointed as the Menopause Service Lead, a role which I'm very privileged to have and very humbled to have been appointed to, and it took my interest on a completely different level. So I started off this journey with menopause, and does ethnicity actually matter? And if we look at the menopause from a medical and a biological model, it's seen as a natural event. And this would tell us that women across the world who are going to go through menopause are going to have very similar physiological and medical responses. Our perimenopause is going to last for maybe 5 to 6 years. We're going to go through the menopause itself with an early phase and a late phase. But looking at the data biologically, Schaunecker in 2014 did a meta-analysis and a systematic review looking at the age of which women go through the menopause, the ANM, across 6 continents. And the table will show that Mayan women, for example, their ANM is around the age of 45, and in Australia, it's about 51. And then Prasad et al. In 2021 looked at the age of menopause amongst Indian women, and it was 46.6. However, we teach and we quote that premature ovarian insufficiency is roughly about 1%, but looking at the data from the Institute of Social and Economic Change, in Indian women, it's roughly about 8%. And why is this important? It is very important. It's a public health concern for women to go through menopause early. And the reason being is because women who go through menopause early are more likely to have quite significant morbidities and even mortality. So there's a higher risk of mortality in women who go through early menopause. And is it good news for women who go through a later menopause? Well, probably yes, in that they will have longer survival rates, greater life expectancy, they have a reduced risk of cardiovascular disease, but there's an increase of breast, endometrial and ovarian cancer. And Gold, in his study, which was published in 2011, also quotes that it's not just our biological model, our diet, our access to healthcare, language barriers, society, but most particularly stress can affect the age of natural menopause. And in his paper, he writes, women of colour are still navigating their professional, their personal lives within race-conscious societies. And this can lead to a constant low level of stress, which is going to have an impact on the age of menopause. So we can no longer look at the menopause from a biological model because we're missing that big picture. We need to look at the menopause as a bio-psycho-cultural model. And when we look at it in that model, we get a more real picture of what women are actually going through at the time of menopause. So looking at it psychologically, Hogg in 2015 again did a systematic review, and this revealed that the experience of menopause is affected by our personal challenges, by the changes in our personal roles within our families, within society. Our children are growing up, they're leaving home. This is going to have a psychological impact on women, which is compounded by their experience of menopause. And also there's socio-cultural backgrounds can affect our experience. And Adekoki also quoted that women who approach the menopause with a negative attitude, so I really don't want to go through this time in my life, are more likely to have a negative experience. Sorry. So there are cultural differences, and the cultural differences will affect our experiences. So looking at data across the world, the lady at the bottom is from Greece, and in Greece it's just seen as a natural time, menopausis. Meno is month and pausis is pause, so it's just seen as a time of pause. In Japan, they don't have terminology for menopause. It's actually called kanenki, which is an age of renewal, an age of regeneration. The Mayan and shaman women actually approach the menopause with a positive attitude because it's a time of freedom. And in the Maori tribes, women who are actually seen on par with men as they approach the menopause, they become the elders of the tribe, they become the wise women in the tribe. However, in the Middle East, which is my background, the menopause, if you translate it from Arabic to English, is the age of despair, sin al-yes. And so if women are approaching the age of despair, it's no surprise that it's not going to be a positive time in a woman's life. So it's complicated. And the British Menopause Society in 2017 commissioned a survey, which was an online survey, so we have to bear in mind that the results are going to be representative of people who are online. Questioned 700 women and 300 men about the menopause, and particularly in relation to relationships. And we found that sex is really off the table. Around 51% of women and 42% just don't feel sexy anymore. And as for the partners, 38% feel helpless, but more than a quarter will lead to arguments, disagreements around this time. And as Helen alluded to, the national statistics are scary. 4 in 10 women who are killed by men in the UK are in the age group of 36 to 55. And that's from the femicide census in 2020. And these are women who are going probably through the perimenopause and menopause. And if we take a little step back looking at the research, there's not much research from the UK in particular, but violence against women is one of the most significant epidemics in the Middle East. And these figures are quite shocking, that 40% of women will be subject to sexual abuse, 59% towards physical abuse, violence, and 91% is psychological violence. And as a young woman who grew up in the Middle East, this is something that I saw firsthand. So I'm pleased that IRSI are sponsoring the event this afternoon, and Helen mentioned this. So Stuck in the Middle with You is a great project, and I'd urge everybody to really look at the data. And this was a collaboration between AVA, IRSI, and funded by the Emmanuel K Foundation. And the main aims of the project were to look at how does the menopause impact on women's experience who are going through domestic abuse, and how women who attend general practice and go for appointments with menopause symptoms, how is that going to be disclosed, and is there any gap in and any more research that needs to be done in this area? The limitations are that it was around the time of COVID, it was focus groups, so there was a small group of women, about 8 women in this group, and the women's ages ranged between 45 to 65. From an ethnic interesting point is that 5 out of the 8 women were from the Middle East. One was white British, and one was white American, and one did not disclose. The key findings from this project was that menopause, women will experience a two-way relationship between menopause and domestic abuse, and that the symptoms and experiences can sometimes cover each other or actually compound each other. But what I really find is really interesting and so important is that the menopause is actually a pivotal time in these women's lives to make change. And it suggests that at this point in a woman's life, who is a victim of any form of violence may be looking to escape that environment. And there are obviously barriers in the way that the women were receiving adequate support. So a little bit about the barriers. Some of the barriers were short appointments, so I couldn't put all the quotes here, which I would have liked to, but short appointments of maybe 3 minutes or so was not enough. And there was a lack of actual inquiry, being quite open and asking the questions, with a lack of signposting, onward referrals, and a lack of having a person-centred approach. That approach that Helen mentioned earlier, the holistic approach, it's no longer good enough just to look at symptoms alone. It's taking a step back and looking at the woman holistically, what's going on emotionally, psychologically, with the body and spiritually. Inadequate mental health support, and women found it difficult to approach male GPs. And then there were the usual language and cultural barriers. So the key recommendations from this project was that women need specialist support, maybe specialist menopause support workers, to have routine inquiry and taking a person-centred approach to care. Women need to be able to proactively ask for maybe female general practitioners, or at least know what their rights are to request a female GP, and have accessible and specific information in different languages to be able to help women, and then relevant signposting, so like RSI. So that was looking at the support that's required from women's perspective, from the victim's perspective. But this study was published in last year in 2023, which is a lovely study to read by McClellan. And McClellan looked at the perimenopause and the menopause help seeking among women from ethnic minorities, and it was the experience of the healthcare professionals and a qualitative study. And she had interviews with 46 primary care practitioners from over 35 practices in 5 regions of England, and also patient and public involvement. And the results of the study revealed that women from ethnic minority groups will present with different and maybe will describe their symptoms differently from their white peers. There is a communication gap, and this is probably due to the lack of awareness of menopause symptomatology, and therefore ethnic minority women are not able to advocate for their health. There's also a lack of confidence and knowledge in primary care clinicians to be able to interpret the symptoms and connect the dots, especially when trying to take a holistic menopause care lens, and this will impact on women's lives and their quality of life. So if a woman does manage to get to see her GP and they establish that this is menopause, what's the attitude of women towards treatment? And this study from Thailand in 2007 revealed that only 25% of women were current users of hormonal therapy, and the greatest concern was the fear of cancer, which suggests that patient fear, there is fear regards to menopause treatment, and there's misinformation. And Blanken in 2022 looked at the attitudes of the veterans towards treatment, and his statement was that despite evidence of high menopause symptom burden, evidence of help seeking and hormone replacement therapy is low in women from ethnic minority groups compared to white women, and there is a racial disparity in accepting systemic and local hormone treatment, and this was a pilot study from Pashad in 2022 in North America. So to put it all together, the experience of women from ethnic minority backgrounds and menopause is that women will enter the menopause earlier, so they're going to be within that period longer. They're going to have a longer transition period, and women will describe their symptoms in a different way. And as Helen mentioned with the deprivation, we know in the UK from the Embrace report and the Commission on Race and Ethnic Disparities is that ethnic minority groups are overrepresented in the 20% of the most deprived areas in the UK. And McClellan, I read this statement, which I feel is really quite pertinent. Acculturation and the stresses of poverty and structural racism appear to play a complex role in menopausal symptomatology, with recommendation to clinicians that ethnicity should be taken into account when interpreting symptom presentation. So over the last 2 years, my talk has changed. Ethnicity does matter. We need to look at the menopause from a bio-psycho-cultural lens. It's a sensitive topic, it's complex, and it's challenging. But when we look into this area, and it's going to reveal things that maybe we don't want to see. Racism exists. Poverty exists amongst ethnic minority groups. And there's fear, some ignorance, and misinformation. And therefore it is time that we start to change this narrative. Ethnicity really matters. And we want to look at all the reds, the poverty, the racism, the fear, the cultural biases, the ignorance, and help women to receive holistic care, compassionate care. So women can come back empowered with the resilience, grit, and tenacity that ethnic minority women are actually well known for. Thank you.